Tonight, before you go to bed, take a quick look at your ankles. Not your feet. Your ankles. Maybe your socks have left deeper marks than usual. Maybe the shoes that felt perfectly comfortable this morning seem a little tighter by evening. Or perhaps you've noticed a slight puffiness around your ankles that fades overnight, only to return the next day. It's such an ordinary change that most people simply move on with their evening. I've been standing too long. It's probably the weather. That's just what happens at my age. Those explanations often make perfect sense. In fact, many times they're exactly right. But what if the swelling isn't the message? What if it's only the messenger? That single idea changes the conversation. Because swollen ankles can happen for many reasons. Long hours on your feet, warm weather, certain medications, changes in the veins of your legs, or something happening elsewhere in the body. The goal isn't to make you worry every time your shoes feel tighter. The goal is much simpler. To understand when your body is asking for a little more attention. That's where many people unintentionally take a wrong turn. Not because they notice the swelling, but because they decide what it means before looking at the whole picture. Kidney disease is often described as a silent condition. Not because the body stays completely quiet. Quite the opposite. It usually whispers long before it shouts. The earliest changes often appear gradually, blending into everyday life so naturally that they are easy to dismiss. A little more tired than usual. A small change that comes and goes. Something that doesn't seem important enough to mention. Weeks become months. Months become years. And only in hindsight do those small changes seem connected. The reassuring news is that the body rarely relies on a single clue. More often, it leaves several. Each one may seem insignificant on its own. Together, they begin to tell a story. That's exactly why healthcare providers rarely focus on one symptom in isolation. They step back. They look for patterns. Here's one of those patterns. Your kidneys help maintain the right balance of salt and water in your body. When that balance starts to change, extra fluid may gradually remain instead of being removed efficiently. Gravity does the rest. As the day goes on, that fluid naturally settles in the lowest parts of the body. For many older adults, that's where swollen ankles begin. But here's the part that surprises many people. The swelling itself isn't usually the most important clue. Its pattern is. That may sound like a small difference. In practice, it changes the entire way the symptom is evaluated. This is also where the internet can become confusing. One article says swollen ankles are simply part of getting older. Another immediately points to kidney disease. Others mention heart problems, poor circulation, or too much salt. After reading several different opinions, it's easy to feel less certain than when you started. A clinical evaluation usually follows a different path. Rather than jumping to conclusions, it begins with observation. Noticing how the swelling behaves. Watching how it changes. Looking for other clues that may or may not appear alongside it. Some details carry more weight than others. And sometimes one small observation completely changes the direction of the conversation. That's the same approach we'll use throughout this video. We're not here to diagnose swollen ankles. We're here to understand them. By the end, you'll have a practical way to think about this symptom without immediately assuming the best or the worst. You'll recognize why the pattern of swelling often matters more than its appearance. You'll understand which changes deserve closer attention. And you'll feel better prepared to have an informed conversation with your healthcare provider if the swelling continues or new symptoms appear. Knowledge doesn't eliminate uncertainty. It replaces unnecessary guessing with careful observation. For many people, that's the first step toward making better decisions about their health. Before we continue, there's one observation that often surprises patients. It has nothing to do with how swollen the ankles look. Yet it can completely change the starting point of an evaluation. Most people never think to mention it. Healthcare providers almost always ask about it. Is the swelling affecting one ankle or both? That's where the real story often begins. If you remember just one question from the beginning of this video, let it be this: is the swelling happening in one ankle or both? It sounds almost too simple. Yet it's one of the very first observations that helps guide what comes next. Not because it provides the answer, but because it helps determine which questions are worth asking next. That's a very different way of thinking about swollen ankles. Let's start with something many people don't expect. Imagine taking off your shoes after dinner and noticing that both ankles look a little puffier than they did that morning. The swelling seems fairly even. One side doesn't look much different from the other. At first glance, that may not seem like an important detail. In reality, it often changes the direction of the conversation. When swelling appears in both ankles in a similar way, it suggests looking beyond the ankles themselves. That doesn't automatically point to kidney disease. Not at all. Several conditions can contribute to swelling on both sides, including changes involving the heart, the veins, certain medications, or the kidneys. The ankles aren't necessarily telling you what the problem is. They're telling you where to begin looking. That shift in perspective is one of the reasons healthcare isn't based on a single symptom. It's based on recognizing patterns. Now picture a different situation. You notice that only one ankle has become swollen. The other looks completely normal. Most people immediately think, can kidney disease affect just one ankle? It's a reasonable question. But here's what surprises many people. When swelling is limited to one side, attention often turns first to causes affecting that leg itself. Perhaps an injury you barely remember, a problem involving the veins, an issue with the lymphatic system, or in some cases, a condition that deserves prompt medical evaluation. The kidneys usually influence the body's fluid balance more broadly. Because of that, kidney-related swelling is more often seen on both sides than on just one. Notice the phrase "more often." Not always. Medicine rarely deals in absolutes. That's why no single observation is enough to make a diagnosis. It simply helps narrow the path that comes next. Here's another mistake that's easy to make. Most of us instinctively pay attention to how much the ankle has swollen. Clinicians often notice something different first. They look at how the swelling is distributed. Imagine two people. One has mild swelling, affecting both ankles almost equally. The other has significant swelling in only one leg. The second person may appear to have the more dramatic symptom. Yet those two patterns can lead the evaluation in very different directions. That's why appearance alone never tells the whole story. Sometimes where a symptom appears is just as informative as how severe it looks. There's one more observation that's surprisingly helpful. Think back over the last few weeks. Has the swelling followed the same routine day after day? Or did it begin on one side before gradually changing? Most people don't keep a diary of their ankles, and no one expects you to. But even a simple memory, "it started a few weeks ago," or "it used to be only my left ankle," can provide valuable context during a medical evaluation. Small details like these help reveal whether a pattern has remained stable or is continuing to change. Sometimes that timeline is just as informative as the swelling itself. So the next time you notice swollen ankles, resist the urge to ask only, "How bad does this look?" Start with a different question. Is it happening on one side or both? That single observation won't tell you the cause, but it gives you a much smarter place to begin. And once you've noticed where the swelling appears, the next step becomes just as important. Not the location, the timing. Does the swelling slowly develop as the day goes on? Or is it already there when you wake up in the morning? That answer adds another important layer to the pattern. And as you'll soon see, it's often the detail that helps the overall picture make much more sense. So far, we've focused on where the swelling appears. Now let's turn to a question that's just as important: when does it happen? It sounds like a simple detail, but it's one of the observations that can completely change how the swelling is understood. Picture 2 different mornings. The first person wakes up, puts on their shoes, and everything feels normal. As the day goes on, the shoes become a little tighter. By evening, the ankles look puffy. After a night's sleep, most of the swelling has settled down. The next day, the same cycle begins again. Now picture someone else. They wake up, take their first few steps, look down, and the swelling is already there before the day has really begun. By dinner, both people may have ankles that look very similar. Yet the story behind those two situations may be completely different. That's why one of the first questions during an evaluation isn't simply, "Are your ankles swollen?" It's, "When do you notice the swelling the most?" Here's something that often surprises people. Gravity is quietly influencing your body all day long. When we're standing or sitting for hours, fluid naturally tends to move downward. That's why even healthy older adults may notice mild ankle swelling after a long day, especially during hot weather, extended travel, or prolonged standing. On its own, that isn't unusual. It doesn't automatically point toward kidney disease. The important question isn't whether swelling appears. It's whether the way it appears fits the rest of the picture. That single shift in thinking helps replace guessing with observation. Now consider a different pattern. You wake up the next morning, and the swelling is still clearly there. You haven't spent the day on your feet. You haven't been walking for hours. Yet very little has changed overnight. That doesn't tell us the cause. It does tell us something else. The swelling is becoming harder to explain with everyday circumstances alone. At that point, the conversation naturally becomes more thoughtful. Rather than assuming it's simply the result of a busy day, it's reasonable to ask whether something else deserves attention. That's why persistence matters. Not because it provides the answer, but because it changes the questions worth asking next. There's another observation that's easy to miss. Slow change is surprisingly difficult to notice when you see yourself every day. Your favorite shoes may begin feeling snug. Sock marks may linger a little longer. Perhaps you start choosing different shoes without even realizing why. None of those changes seems dramatic on its own. Viewed over weeks or months, however, they can begin to tell a very different story. That's one reason clinicians often ask, "When did you first notice this?" They aren't expecting you to remember the exact date. They're trying to understand the direction of the change. Here's an idea that's worth remembering. Most people focus on today's swelling. Clinicians often pay even closer attention to the trend. Think of it like looking at a single photograph versus watching a short video. A photograph captures one moment. A video reveals movement. The same is true here. One unusually hot afternoon may explain swelling on that particular day. A gradual increase over several months tells a very different story. That's why noticing change over time is often more valuable than judging how swollen the ankles look on any single day. By now, you may have noticed a pattern in the questions we've been asking. Where is the swelling? When does it happen? Neither question is designed to diagnose kidney disease. And that's exactly the point. Health professionals rarely rely on a single observation. Instead, they step back, compare several clues, and look for the story those clues tell together. That's a very different approach from searching for one symptom and expecting one answer. The next time you notice swollen ankles, don't worry about finding the explanation immediately. Start by becoming a careful observer. Where is the swelling? When does it appear? Has anything changed compared with a few weeks ago? Those simple observations won't diagnose the cause, but they'll help you describe what's happening far more clearly when you speak with your healthcare provider. And there's one more clue that often helps everything we've discussed begin to fit together. It isn't about where the swelling appears, or when it happens. It's about what else is happening at the very same time. Because swollen ankles rarely tell the whole story by themselves. The clearest answers often appear when several quiet clues begin to point in the same direction. So far, we've answered two important questions. Where is the swelling? And when does it happen? Those questions already tell us far more than swollen ankles alone ever could. But there's another question that often changes the conversation. What else has changed? Many people focus only on their ankles. It's understandable, that's the symptom they can see. But our bodies rarely send just one signal at a time. Imagine two people whose ankles look almost identical. One feels otherwise completely well. The other has recently noticed lower energy, less appetite, rings that suddenly feel tighter, and shoes that seem snug by the end of the day. The swelling looks the same. The story does not. Those extra changes don't point to one specific disease. Instead, they help create a clearer picture of what's happening. That's why one simple question can be surprisingly valuable. Has anything else changed recently? Not just your ankles, your daily routine, your energy, your appetite, or even the way your clothes, shoes, or jewelry fit. Sometimes the smallest everyday observations become the most useful pieces of the puzzle. Another area that deserves attention is urination. Have you started getting up to urinate more often during the night? Have you noticed you're producing less urine than usual? Has the appearance of your urine changed? Each of these can happen for many different reasons, and by themselves, they don't identify kidney disease. But when they are viewed alongside other changes, they become much more meaningful. That's what surprises many people. Individual observations may seem ordinary. Together, they can tell a much richer story. Instead of thinking about isolated symptoms, begin looking for trends. Has the swelling stayed about the same? Has it slowly become more noticeable? Are new changes appearing over time? Small observations often become much more valuable when they form a consistent pattern rather than a single moment. Many people don't overlook important changes because they're careless. They overlook them because each change seems too small to matter on its own. Only later do they realize those small observations had been quietly adding up. And that's exactly why paying attention early is so valuable, not because it lets you diagnose yourself, but because it helps you recognize when something deserves a closer look. So far, we've learned to ask, where is the swelling? When does it happen? What else has changed? Those three questions already reveal far more than swollen ankles alone ever could. But there's one final piece that can completely change how those same observations are understood. Because even when two people notice the same swelling, at the same time, with many of the same accompanying changes, the meaning may still be entirely different. Why? Because of something that's unique to every individual. Their own health history. And that's the final clue we'll explore next. By now, you may have realized something surprising. This video was never really about swollen ankles. It was about learning how to understand what your body is trying to tell you, without jumping to conclusions or ignoring changes that deserve attention. We've looked at where the swelling appears. We've explored when it happens. We've talked about what other changes may appear alongside it. Now comes the final question. Who is experiencing these changes? That single question often changes how every other clue is interpreted. Imagine two neighbors. They are both 72 years old. They both develop swelling around both ankles. At first glance, their symptoms seem almost identical. But one has lived with high blood pressure and diabetes for many years. The other recently started a medication that's known to cause ankle swelling. The symptom looks the same. The context is completely different. And that's one of the biggest lessons from this entire video. Your age alone doesn't determine what a symptom means. Your overall health story does. Healthcare providers don't rely on one symptom. They look at the story surrounding it. Long-term conditions like high blood pressure or diabetes don't automatically mean swollen ankles are caused by kidney disease. Instead, they provide important context that helps determine whether further evaluation may be appropriate. Sometimes the explanation is even simpler. A recently started medication may account for swelling that has nothing to do with declining kidney function. That's why one simple question can be surprisingly helpful. What has changed recently? Sometimes the answer is found in your medicine cabinet rather than in your kidneys. If you've ever looked back and thought, I wish I had paid more attention sooner, you're certainly not alone. Many older adults don't miss important changes because they don't care about their health. They miss them because those changes often happen slowly. Shoes become a little tighter. Sock marks last a little longer. A ring feels more difficult to remove. Each change seems too small to matter. Only later do they realize those small observations were connected. The encouraging news is that recognizing those connections doesn't require medical training. It simply requires paying attention. So if there's one framework worth remembering after today's conversation, let it be this. Instead of asking, do swollen ankles mean kidney disease? Ask 4 better questions. Where is the swelling? When does it happen? What other changes have appeared? What does my health history add to the picture? Those 4 questions won't diagnose kidney disease. They're not supposed to. They simply help you become a better observer of your own health and prepare you for a more productive conversation with your healthcare provider. If ankle swelling is new, keeps returning without an obvious explanation, gradually becomes worse, or appears together with other concerning changes, such as noticeable changes in urination, rapid weight gain, increasing shortness of breath, or symptoms that simply aren't normal for you, it deserves a medical evaluation rather than continued guessing. Seeking medical advice doesn't mean expecting the worst. Sometimes you'll discover the swelling is related to medication, circulation, or another common condition. Other times, early evaluation allows kidney disease or another health condition to be recognized while treatment options are still most effective. Either outcome is valuable. Because the goal of this video was never to teach you how to diagnose yourself. It was to help you observe your body with greater confidence. So tonight, if you happen to glance down at your ankles again, don't look at them with fear. Look at them with understanding. One symptom rarely tells the whole story. But now you know how to ask the 4 questions that help reveal the bigger picture. Knowledge doesn't replace your healthcare provider. It helps you know when it's time to have the conversation. If this video gave you a clearer way to understand your body's signals, consider subscribing for more evidence-based health guides designed for adults over 60. And if someone you care about has ever wondered whether swollen ankles are just part of getting older, share this video with them. It could help them notice the right changes, ask better questions, and seek medical advice with confidence rather than uncertainty.